Hello, everyone, and welcome. We're so excited to have you with us today for our UltraClear webinar with Said Dermatology. We have a great presentation prepared to educate you on our newest laser device. We'll explain how it works, what it treats, and why we're so excited. If you've been considering laser treatments or are curious about the latest advancements in aesthetic technology, today's session will give you a clear understanding of what makes UltraClear unique. We'll also reserve time at the end for a live Q&A with Dr. Samireh Said, so please feel free to drop your questions in the Q&A box at the bottom of your Zoom screen as we go. If you experience any technical difficulties during the webinar, you can use the chat feature and I'll be here to support you. Be sure to stay with us through the end because we'll have a fantastic Q&A session as well. Now, let me introduce our wonderful speaker. I'm pleased to introduce Dr. Said, who is a double board certified dermatologist and Mohs surgeon with over 27 years of experience. She opened up a private practice in 2004 where she is committed to staying on the cutting edge of laser technology and treatments. Dr. Said is a leader in her field and brings a warm, empathetic approach to her practice, providing patients with the best results possible and treating them as part of her extended family. Dr. Said, without further ado, the floor is yours.
Thank you so much for joining me on this webinar. And we're going to talk about UltraClear, which is my newest laser. I absolutely love this laser, so it's a pleasure to talk about it. I think I talk about it all day long, so let's add some more talking about this. So again, I'm in double board certified. I'm in Tustin, California, which is between Irvine and Newport Beach. And I've been practicing for many years, and I'm excited to have this new erbium laser. So the nice thing with this laser is that it's the first cold ablative fractional fiber laser. And this is a little overview, so watch this.
The first. The first of its kind, cold ablative fiber laser solution. The first device to give new life to all skin types. Finally, a way to treat every single patient. UltraClear, the first safe solution for sensitive skin, especially skin of color. Optimized to individual needs. Balancing cold and thermal energy at the optimal wavelength. Ablative resurfacing and 3D collagen remodeling in one pass. Delivering each pulse to the exact depth with precise timing. Minimizing risk and pain. Allowing faster healing with optimal results. Keeping patients safe from discomfort and side effects. Something they can count on every time, no matter what. Letting them get back to their day quickly and making sure they feel amazing when they leave. Be the first and move your practice forward. UltraClear, the clear choice to reverse the signs of aging for all skin types.
So let's see if you're a candidate for UltraClear. UltraClear is a revolutionary technology that offers safe and effective treatment for everyone. It's ideal for anybody that has uneven tone, texture, fine lines, wrinkles, acne scars, pigmentation, sun damage, age spots, and just wants their overall skin to look healthier. And it's really cool because you can use this technology for all skin types, from simple pigmentation on the skin to deeper acne scars on the skin and deeper wrinkles. And one of the reasons that I picked to purchase UltraClear is that there is an excellent result without the pain. So it is the first full pulse technology to treat without excessive heat like the other lasers, which offers dramatic results and significant less downtime and pain. So, and it's safe for all skin types. So you can do multiple skin problems with one single treatment. It's versatile. And so, for example, you can treat with a certain setting around the mouth area. If there are more wrinkles, you can do different setting for forehead for fine lines and a different setting for areas that have pigmentation. And the lighter treatments can take as little as 15 minutes with no numbing and virtually no pain. And for more serious skin concerns, we do provide numbing cream beforehand. And the nice thing with this treatment is that you can treat your face, your neck, your hands, your chest, and also if there's some brown spots in different locations on the legs as well. So, first of all, when I assess a patient, I look at their skin type, and depending on their skin type, we go through all the different options that I have for patients. I usually say, how much downtime do you want? What is your budget? And what do you really want to assess? And so the treatments we had in the past, like our old CO2 lasers, they were great for type 1 skin. The downside was that a lot of them would have depigmentation and it would take all the skin, but it didn't allow the skin to cool as much. And so now with the ultra clear laser, the cool thing with it is that because of the pulse size and the fact that it has this 3D IntelliPulse technology, I'm able to treat all skin types. So anyone that comes in, they can have darker skin type, lighter skin type. I can actually treat them. We assess what type of skin they have, obviously, but also I'm able to offer this amazing laser for them. And there's different levels. So obviously, when you're looking at the skin, we have the top layer of the skin, the epidermis, where you have the little pigmentation that you might experience, and then the dermis is where we're seeing more of the wrinkles. And if there's some more deeper scarring, we do want to do a little bit more of laser coring, which all three are addressed with this one laser, which is incredible. And so when a patient comes in and they're younger and they just want a little bit of the pigmentation, they want a little bit of a glow, I can do a setting for their face that is called 3D Miracle, which is more superficial. If they have a little bit more fine lines, then at that time I do a little bit more deeper laser as well as a superficial laser. So I do not just one pass, I do two passes. And then if someone has a little bit more deeper wrinkles, I will do a third pass on them, which is a coring pass, which will help with those lines in more depth. The UltraClear was founded in 2018, and I had the pleasure of meeting the founder and the developer of this machine. And he was explaining to me how it was devised, and we're going to go through that in a little bit more depth later on in the talk. But as I explained in the past, it does provide a lot of treatments that got cleared for fine lines, wrinkles, age spots, scarring, precancers on the lips, skin resurfacing, and then in 2024, it also got approved for benign pigmented lesions as well as vascular dyschromia, which is like redness in the skin. And the difference between this erbium laser in comparison to the other older erbium lasers is that it provides less pain and it heals quicker because there's more spot size and there's an increased number of channels per area treated. So in comparison to the old erbium and the CO2, you can see in this ultra clear image, you can see more holes are in this one little patch in comparison to the other erbium and the CO2. So you're not only able to heal it quicker because of the spot size, but also there's another thing that I'm going to show you in a bit about the 3D IntelliPulse technology, which is rather than just like one harder beam, this has a little short mini pulses so that there's time for the skin to cool, and that's why it's called a cold fiber laser. So this is that 3D IntelliPulse technology that I always talk about. And this is a little video, so I'm going to share it with you guys. So the 3D IntelliPulse technology, as you can see with this little video, it has a blended pulse technology. So with each pulse, you get deep ablation. It delivers four ultra pulse micropulses at the same time. And then there's like a period of a little bit of cooling in between. And so this is why it's called a cold ablation. and it reduces patient discomfort and your it allows your skin to heal faster too. So in comparison to the old technology where like a CO2 you get 40% coag and 60% heat, this does a 95% coag and only 5% heat. And because of that, you end up having less heat, and that's why you get less pain. And this is another video I like to share. And
Most devices have an optical cavity that contains their gain medium to create their wavelength. The UltraClear is very unique. We don't have an optical cavity. We use a fluoride fiber that has been doped with erbium impurities to create our 2910 wavelength. This native wavelength has a absorption of water that creates a 95% ablative effect and only a 5% thermal effect. Now, if you compare this with other devices, for example, a CO2, which has a ablative percentage of 40% and a thermal percentage of 60%, that's a lot of heat. So by comparison, we are much cooler. We're cold fiber laser.
so again, the UltraClear delivers same amount of energy, but it's divided in four small micropulses. The treatments are much more comfortable while achieving the dramatic results that you see with an erbium and a CO2. And these smaller micropulses allow for greater precision and control and reduces the risk of unwanted side effects. Because if you get too much heat, then there's more chance of pain as well as scarring. And so this is a little video of 4 cases of what ultra clear treatment is like. So let's go to the first one.
So
And
here I am doing eyelid resurfacing with the UltraClear laser, and I'm doing the coring to get rid of some of the extra skin, and it's quite precise. It's sort of nice treatment.
and as you can see with that video, he had intraocular protection, metal intraocular protection. That's why I could go so close with it. And then this is, you could sort of see the intraocular.
What laser are you doing? I am doing UltraClear on one of my favorite patients. He has these eye shields on because I did around his eye already. Isn't that cool?
Wow, that sounds amazing. And what does this laser do?
It's going to help with fine lines, pore size, pre-cancer, make your skin smoother, help with texture, has a tightening effect. It does a lot of things in one.
And then this is the third
So she's
video.
all washed up and she's consented. We took the aura. Now I'm going to apply some eye mask for you. And a little eye shield here. And then eye shield.
So this is me doing a 3D ultra clear on this patient. She has a little bit of melasma. So obviously we cover her eye. We've already consented her. I usually do an aura image of the patient so we can follow the patients beforehand with a 3D imaging.
I am going to wear a mask. Hopefully you can still hear me. If not, Ken is in the background and he can answer your questions.
And so this patient did not have any numbing cream. She just came in, and we're gonna do a nice 3D um, miracle on her. So this treatment is really cool because you can basically do it on anybody with any little bit of pigmentation on the skin, and it takes about 15 minutes to do the face, and if you're doing face and neck, it's about 25 minutes.
One-time use. We sterilize these each time.
And so during the treatment, it's usually myself only. There is a little bit of noise because there is a smoke that happens. So you'll be seeing some smoke, but I have a smoke evacuator that is attached. And so this is me doing the treatment with the smoke evacuator attached. And there's a pattern that we see on the skin with
And
each
hold.
pulse.
Okay.
And then I just go
You can see
down
me
the
slowly
entire
white
face.
rings.
And depending on the skin type,
And
I will
and
be more aggressive or less
good. I
aggressive
like to do up
accordingly.
to the 25.
And
Is that
this
okay?
particular patient,
Good.
she's
I like
actually
to do
coming
that.
back next week for another treatment.
And
Usually, when you're
see if
doing
it
it for
feels on your skin.
melasma or
Stay
pigmentation, it
on.
can take
And
3 to 4
good.
treatments to
Nice
come
and
in once a
gentle.
month for it, or as often as you can. Some patients can't come in a month, so they come in at 6 weeks or so. And after the treatment with this, their skin looks a little bit white and it looks like little round circles are on the skin, but that does subside over time. And it's about 3 days. But I did one of my friends on Friday and I saw her on Sunday, and it didn't really look like much was done on her skin. But it does definitely make her skin more brighter. So again, talking about the superficial 3D miracle, it's meant for patients with that are a bit younger, that have a little bit of pigmentation on their skin, and they want their skin to glow. After the treatment, you'll see immediate redness that could stay a little red for an entire day, and then in about a week, it sort of subsides. Mhm. And this is like another patient. I mean, she's already looking great, but doing a little bit of 3D will make her skin look a little bit brighter and happier. And another patient, I can also stack it with other treatments. So I see some blood vessels here on this particular patient. I probably would have treated the blood vessels first and then followed up um, with the 3D miracle. And again, another patient, the same, she has a little bit of pigmentation, and by doing it, it makes her skin glow better. And another patient with quite a bit of sun damage. And so by doing the 3D miracle, it just makes her neck look a lot more healthier. And another patient, again, sometimes you don't have to do such an aggressive treatment, but even a light treatment will make patients feel so much better about their skin. And another patient, and this is 1 month after 3 treatments. So the results are relative. I mean, to me, her skin does look a lot brighter. Um, but normally what happens is that the area that you could really notice the difference is on her forehead, where there's some pigmentation here and here. It's sort of subside a bit. And so that makes patients really happy, just to make their skin a little bit more brighter. And this is a sunspot. It was apparently biopsied, and they found that it's just a lentigo. And this is 4 months after 2 treatments. So one treatment improved it, and obviously you need a second treatment here too. And again, after 10 months after the second treatment, it's not completely gone, but it's significantly better. And another after 2 treatments. And this is after 3 treatments. And a lot of patients ask me how many treatments it takes. Obviously, I want to give a result with one treatment. But normally, what happens is that you don't want to do too much when it gets to the extremities, because when you get further away from the body, things heal slower. So it's nicer to do one treatment and then get rid of some of the pigmentation and then have them come back and do another more aggressive treatment after that. And the patients understand the process. And for moderate sun damage, where you get more wrinkles, after the treatment, they look swollen. The next day, they look worse. And the third day, they don't look that much better. But then by fourth and fifth day, it's so much better. And it's amazing how quickly they can respond. And this is after one treatment under the eye. Um, and this is after a surgical scar. So it just makes the surgical scar significantly better. So we do different settings. It's a deeper setting because we're trying to stimulate the collagen to produce more collagen. And this is after one treatment. So the things you notice is like the pigmentation here is less, the fine lines are better. And it all depends on the setting you did on for this as well, because sometimes the settings are more aggressive, sometimes less aggressive. So Sometimes I look at the results and it's just incredible because if I've done a more aggressive treatment, I try to do laser coring on most patients because I do feel like being a little bit more aggressive around the mouth makes the patients have a better result. And this is another patient before and after, and a patient that was treated around the eye area, another one on the cheek area, one with acne scars. So this is exactly why I bought this machine. Is acne, and acne is scars are really close to my heart, and I don't like anyone suffering with acne scars. So my Fraxel did a good job, but I wanted something a little bit better, and this is my little bit better. And also, I got it for the neck area. As you can see, like it really made such an impact on the skin. Obviously, you could do other modalities, but this is quite impressive. And again, after acne scars, after one treatment, after one treatment, after one treatment, after three treatments. And so the more wrinkles, the more treatments. They did ultra clear. Don't see the coring being done, but I would have done the coring around the mouth, especially. And so let's talk about laser coring, and this is a little video for you to watch. And so with the laser coring, you see this energy that is basically little holes are made, and we can decide on the percentage of the skin we want to be removed and the depth we want removed. So we can go if it's really thick skin, 0.75. If not, then we do 0.5 millimeters. And then we can, depending on the area, we can do between 1 to 3% of the skin can be cored. And it's really cool treatment because it does make the skin less saggy and also helps with the scarring a lot more than if I had not done the coring. And then this is a patient of mine. So Ken, he participated and he was in my Instagram live as well. And so this is day one. He really allowed me to do more aggressive treatment. So it looks bad the first day, worse the next day. It starts getting better day three. And then by day seven, he looks so much better. And every time he sends me a picture, I'm like, wow, he looks so good. And this is a little testimonial he did as well. And I
Hi,
didn't
this
pay
is
him.
day 39 after laser resurfacing my face and neck. I asked Dr. Saeed to use the highest power for the strongest benefit of coring using the UltraClear laser system. I'm really pleased with the results. I'm seeing fine lines and wrinkles are much subdued around the eye area. I like what she's done with the eyelids as well. And the neck area looks better too. It's still a little bit pinkish after 39 days, but the skin just looks more vibrant and youthful. So if you haven't guessed my age by now, I'll be 74 years old in about 4 weeks, May 24th. So I'm really pleased with the results, and I think you will be too if you use this new technology.
Mhm. So no, I did not pay him. He's just a very good patient. Like all my patients, I feel like I owe them a lot. They're just so kind. And this is not my patient, but after one treatment, you can see how much improvement her skin got. This one is after 5 months after one treatment. So a lot of people, they wonder, when am I going to see the results? It's usually takes 3 to 6 months for the collagen remodeling to happen. You will notice the discoloration, like the pigmentation, immediately within the first week, but the depth for the wrinkles does take 3 to 6 months. And so again, this is 6 weeks, but I'm sure she's just going to keep on looking better in 6 months. And this is 6 weeks. This is 1 month. And I'm open to questions if anyone has any questions. Thank you so much, Holly.
Fantastic. That was amazing. Thank you so much, Dr. Saeed. I cannot wait to get my treatment done. Those results are fantastic. We have a couple questions that have been coming in pretty steady here, so we'll go ahead and start with the first one. Let's see. Can you mix the modes for one patient on different parts of the face?
100%. And I always do that because each area of your face is different. You'll have thinner skin on the forehead, thicker skin sometimes around the mouth, sometimes thicker skin on the cheek area, a little bit thinner under the submental area. So I definitely customize with what I see. I discuss it before I do the treatments. And I love the laser because it is something like sculpting the face. So I'm enjoying it thoroughly.
Awesome. How long do the results last, and can it be done with Botox?
100%, Botox is my lowest hanging fruit. I do Botox on almost anyone. I started in my 20s and I highly recommend it. But in general, with the Ultra Clear, the results are permanent. So, we lose 1% of our collagen every year. And by doing one of these modalities, and I have multiple different modalities in my office, this is just another one of my options. But every time you do it, you get increased collagen, you're getting rid of old senescent cells, you're producing new collagen. And if you keep with a good skincare regimen, it just gets better. So you're never going to lose the benefits of doing the Ultra Clear.
Awesome. Let's see. Does it help with deep wrinkles on the neck?
It definitely helps with the deep wrinkles on the neck. The neck has less oil glands than other places in the body, so you have to be careful with how aggressive you want to be on the neck, and it does take multiple treatments. So I find that, if somebody says you're going to be perfect with one treatment with any laser device, um, they're probably haven't done as many as I've done. So I think in general, every treatment, every laser takes multiple treatments, and it's the turtle, not the rabbit. You don't want to do something and have scarring. You don't want to have any complications. You basically want to do each treatment. You want to have good results, but be patient. It's not a
Mhm.
facelift, it's a laser device. It is definitely going to help with the fine lines, the pore size, the pigmentation. It's going to make your skin smoother. It's going to probably help with the precancers. It's just overall going to make your skin look healthier. So each treatment, you'll notice a difference. But I do think that people that let their wrinkles get really bad, they probably need more than one
Mhm.
or two. And they should probably anticipate doing it once a year, twice a year, 3 times a year. And I usually make a plan for them. So I would say, okay, you're going to do the vascular laser twice a year. You're going to do the ultra clear once a year. You're going to do Fraxel once a year. You're going to do Zerferal therapy for tightening your face once or twice a year. So I keep them on a regimen. And then if their upper lip is lengthened, I say I might do an Ellacor as well. So and sometimes I stack them on the same day too. I might do one laser on one location, another laser on another location. But I think if we make a nice plan for you, you're not surprised. And also it depends on your budget again. So but I do find the Ultra Clear is the biggest bang for your buck because you do have all the lasers in like one laser, and I can do a lot of things with this one laser. So it's really been real fun doing the laser. I think it's one of my favorite lasers to do right now. Mhm.
Awesome. I love that. Let's see. What does the aftercare treatment look like?
So afterwards, depending on which level you did, if you just did 3D Miracle, you can just put some sunscreen and walk out and you're fine and you just do your normal skincare regimen. If you're doing a more deeper laser treatment, I do send you home with some vinegar water and a moisturizer and a spray that's a hypochlorous acid to prevent infection. So the
Mhm.
vinegar water and the hypochlorous acid prevents you from getting the area infected, and then the moisturizer is a barrier cream that I recommend with a treatment. And I give them gauze and tongue depressors so that they have everything they need before they leave. And so they start doing the soaks with the vinegar water 3 to 5 times after the treatment, and they put the moisturizer on. And they usually need to do that for the first couple days. And then after that, they just stick with the moisturizer. If they have a lot of redness in their skin, I might even add a little bit of a topical steroid for the first 3 to 10 days.
Awesome. How often should we do the treatment? I know you kind of alluded on that with like the treatment plans, but do you have any recommendations as far as how often per year we should be doing these treatments?
So it depends on if you're doing 3D Miracle, you could do it like once a month for 4 months, or less. I don't have any packages because I always feel like people should do if they love it and they're happy with it, they do another one. And each person's schedule is a little different. So some people can come at 1 month and some people can come at 6 weeks. But with the Ultra Clear, I do like the skin to be really well healed and the collagen remodeling to have somewhat happen. So I like to spread it by at least 2 months.
Mhm. Perfect. All right, I think we got time for maybe just one or two more questions here. So, next one is, what should I do to prepare for my treatment?
So, before the treatment, you want to be healthy. If you have a cold, you're not feeling well, you're just under the weather, your protein intake is not good, you're in the sun, you have a tan, probably should reschedule it. But normally, I do give a cold sore medication the day before, the day of, and the day after. And if you have history of multiple cold sores, I might start that a day or two beforehand. And then the day of the procedure, you come in for an hour before for we do a visual imaging with my 3D imaging device, my Aura. And then we put a headband on you and then numbing cream, and we let the numbing cream sit for an hour. And then I do the treatment. And the treatment varies between 15 minutes to 45 minutes, depending on if I'm doing your eyelid, I have to put intraocular shield in, if I'm doing your face, neck, chest. So, depending on the areas I'm doing, so it varies with the time. And usually I get my patients ready to be out of the door before they even start the procedure. So that way they're comfortable and they have my cell phone. And then they just follow up with me daily. It's a little bit more hand holding than the other lasers because there is a little bit more healing involved. And usually the next day, if it's the first time, they usually send me a picture and say, "What did you do to me?" And then I tell them it's going to be okay.
Awesome. That's fantastic. Okay, last question. I'm interested. What are my next steps?
The next step is to either call my office, 714-669-0844, or email my office at ssoffice9@gmail.com, and then we can return your call. I prefer in-office consults beforehand just because the appointment is a long procedure. It's like an hour and appointment that I block off for you. So I like to assess you and see if we're compatible because it is like you have to like me, I have to like you. I don't do lasers. Just willy-nilly. I like to know people really well. In my office, it's more like taking care of my family. And I don't want to do anything unnecessary. If you don't need it, I don't want to do it for you. And as I always say, you have to be begging me to do a procedure because I like people that really, really want me to do a procedure and are really well educated and they know what they're getting into and how many treatments they need and their budget, etc.
Awesome. Perfect. Well, thank you so much, Dr. Saeed. Everybody who tuned in with us live today, thank you so much for taking the time to listen to
Thank
us and
you.
learn about UltraClear. Can't wait to see everybody in the office soon.
Thank you so much.